Hello, residents of Freedom Village. This is John Bruner, your Executive Director, and I'm sitting here today with Dr. Andrew Ulichney, our wonderful medical director, who we're so proud to have working with us throughout this pandemic, guiding us along with our COVID task force. And just yesterday, we met with Dr. Ulichney, the rest of our members of our task force, to talk about a very important topic, because after February 20th, about 98% of the residents on our campus will have been vaccinated, which is really exciting. It was amazing that we were able to bring the vaccine here. Essentially, almost all of our residents in skilled nursing, memory care, and the gardens here in the month of February have already received their second dose. Almost 99% of our residents here in independent living, as of February 20th, will have received their second dose. So this is exciting news. I'm cautiously looking forward to reopening, but that was the reason we met with Dr. Ulichney and the rest of the members of the task force to discuss those aspects of reopening and what we should and should not be doing once we do reopen. This Friday, I'll be putting out a communication in regards to what we talked about at the task force meeting and what items will be opening starting on March 8th. So, if I could, Dr. Ulichney, I wanted to talk to you a little bit about the high participation rate, what you think that means for our community, and what's your thoughts on that level of participation amongst our residents?
Okay, well, first off, John, it is great to see you. Unfortunately, you had your bout of medical issues, so it's just so wonderful to see you back doing what you do so well. And again, folks here at Freedom, I have to tell you, you are extremely lucky to have John, Shannon, Nathaniel, Jackie, Stephanie, Katie, Maxie. You have an exceptional leadership team, and you're doing stuff that other facilities wish they could do, namely the fact that even we're talking about opening facilities back up because of the high vaccination rate. It's unheard of for other facilities, and if you mention it to anyone, they're extremely envious of the fact that John and his team was able to put together the strategy to get the independent folks vaccinated. The team, the employees getting vaccinated is about the national average. There is some apprehension with any new vaccines, and I understand that it's a very personal decision. We cannot mandate vaccination. It's still under investigation, all of these vaccines. So it cannot be mandatory under current guidelines. Because that's a question that comes up both at Mainline Health and other facilities. We are not going to be able to disclose who's vaccinated, who's not vaccinated. That's protected health information. Mainline Health, there is no plan, just based on the logistics of employees, to have two tiers of those who are vaccinated and those who are not. So again, I applaud the fact that so many of the patients and the residents here at Freedom Village have been vaccinated, and hope that more employees across the region, including Mainline Health, that we will see a higher participation rate.
So my next question, Dr. Ulichney, is we're almost exactly 2 months out from the emergency use authorization of both the Pfizer and the Moderna vaccine. In the case of Pfizer, which is what all the residents and staff here at Freedom Village received through CVS. So now it's been almost 2 months that they've been vaccinating folks. And initially we read a lot about the efficacy and the safety and the limited amount of reactions or bad reactions that people have had, as well as, again, the efficacy of the virus. How much of it has it changed since those 2 months that it's been out, or how much do we still need to just wait and see, and are we going to learn as time goes on?
This whole year has been a very steep learning curve. We know that the efficacy both of Moderna and Pfizer is over 90%. In terms of side effects, luckily here and at Mainline Health, we have not had major side effects. The biggest one that we've had is some local reactions. Some people feel tired, achy. There have been no major anaphylactic reactions. Of more than 39 million doses given across the country, there have been less than 40 people who have had some changes to their blood counts. And so that was a relatively new finding. But again, 40 versus 40 million gives you a perspective of these cases are extremely rare. So in terms of side effects, it's kind of like the flu shot on steroids. People feel tired, achy, but not everyone is having those side effects. In terms of the efficacy on the current strands that we know of, it's well over 90%. There is very good faith that some of the newer strands, people hear about the United Kingdom and Brazil and South Africa, and I think you're basically getting the idea that the virus is just going to continue to mutate, and I think you're going to end up with every country in the globe having a strand or a strain. And once COVID is in our population across the world, this is something that's not going to go away. Despite vaccination, we're going to have to likely get periodic vaccinations either every year, twice a year. It'll remain to be seen, but just the nature of the virus, all it wants to do is reproduce. And so it has found a good host in the human population. It's reproducing very efficiently, and we're just going to continue to have to try to be protecting ourselves through both vaccination. We don't know how long the protection lasts. We know that it protects the recipient of the of those who receive the vaccine. We don't know if it cuts down on the carriage, being able to infect others. The anticipation, if I'm not infected, I will not be able to reproduce the vaccine to become the vector to other people. The data is pending on those studies, but I can't definitively tell you but it makes implicit sense that if I'm not sick, I will not make others as sick.
Great point. Now, Dr. Ulichney, I've read a lot about these different variants that you mentioned, and several articles I've read seem to indicate that the drug makers are saying that they believe the Pfizer and the Moderna vaccine are effective against the variants, but how certain can they be?
And things will change. As we've seen, we're learning a lot, and the virus is also continuing to do what viruses do, and that's mutate. Sometimes the mutation is good, it's less virulent, but it becomes more infectious. So we will find out over time how long-lasting our current vaccination strategy is effective and when we have to get our next booster dose.
So based upon that bit of uncertainty, I think that's why we probably are taking the right approach here at Freedom Village. We are going to start reopening, but clearly we're not wavering from the guidance of mask wearing, as you and I are, social distancing, and having certain limits to the size of gatherings.
Yeah, and I don't see that changing anywhere in the near future, unfortunately. And I know everyone's chomping at the bit to get back to doing what we used to do. And I think it's a little premature, as we've seen just around the holidays. I'm happy to say Mainline Health, our numbers have decreased steadily over the last 3 weeks. We had about a peak of, between the 4 acute hospitals, about 270 patients, pretty much from the beginning, middle of November through the middle of January, towards the end of January. Only now are we starting to see it come down, but we still have over 130 patients. Many of them, unfortunately, are in the intensive care unit. Many of them are kind of stuck in this holding pattern of requiring a great deal of support.
Well, those are good numbers, from to go 270 to 130, so that's promising. It
Yes.
sounds consistent with what I'm seeing throughout the rest of the state and the country as far as the trends, and all we can do is be hopeful the trends continue in that direction.
And Shannon and her team and the residents in the skilled section, because our prevalence rate is finally below 10%, we're down to once a week testing, and that's going to continue regardless of vaccination status. And if we get below 5%, which we have not seen in this area since October, then we'll be able to decrease our and not have a mandatory all employees, all residents request for screening tests every week.
Well, that makes sense. If the risk drops, we can certainly lower the level of heightened
Surveillance.
testing,
Yep.
surveillance. So we talked about the fact that mostly there's seniors, more the elderly are affected and in the hospitals. But as we talked about earlier, I firsthand know that the COVID infections with COVID-19 can be pretty serious.
Yes.
So, we have a lot of employees my age, younger, some older, and about 45% of our employees did get vaccinated. And it is a personal choice, and there's many personal reasons why some people choose not to. So we do respect that, absolutely respect that. But what are the upsides, you would say, to an employee that is on the fence? How could it really protect them, protect loved ones around them, protect their residents?
So it will protect them definitively more than 90% of the time. It's not 100%, but even those who do get infected have less virulent reactions to the infection. We think by the fact that you decrease the amount of infection, you're going to decrease the amount of spread. So that also is critically important. And I would strongly think you're not just protecting yourself, you're protecting anyone in your house that you encounter, family, friends. And we do think that if we can get the community in general, a population to at least a vaccination level of over 70%, we think herd immunity will kick in, and that will allow us to get back to doing what we used to do.
Well, to me, that sounds like a great reason to get more people vaccinated because, as you said earlier, we don't want to wear these forever.
No.
We want to resume our lives no matter how old or young you are. This has been hard for everyone, and I applaud our residents, our staff here. Everyone has had to endure so much, and we're strong, and we're making it through, and we're making great strides and doing wonderful things for our residents, but we want to see it end.
Correct.
We want to see it end.
And the vaccination pathway is our best path forward. It beats the heck out of everyone being infected to the 60 to 70% level.
Well, thank you, Dr. Ulichney. I really appreciate your time. I appreciate all your efforts in helping us, and I think we make a great team, and we're so glad we have you.
I'm lucky to be here. I'm so glad you're back, and hopefully as the snow diminishes, the temperature is warm, we can start opening even more of the community up. And I will tell folks at Freedom Village, one of the best defenses that you can have is exercise, 30 minutes or more every day. That's one of the reasons why we're pushing really hard to get the gyms open, classes started, hitting the pool. All of those are critical both for your mind, your immune system, and it decreases the risk of other things that used to be front and center on people's minds, like heart disease, high blood pressure, diabetes.
So keep moving, keep exercising.
Absolutely.
All right. Well, thanks again, Dr. Ulichney. Thanks for
you.
joining us.